Senator Ron Johnson, Republican from Wisconsin. As we said, fellow party members in the state Senate there want a past COVID infection to count for a jab. Senator, it's good to see you. Thanks for the time. Let's start with this situation in Boston. Why have you decided to support their cause, a senator from Wisconsin and first responders in Boston?
I spoke with those officers and first responders. And the fact of the matter is as we learn more about COVID, about the vaccines, about their effectiveness, it's becoming obvious that these mandates just simply don't make any sense whatsoever. We're going to really harm our ability, for example, to staff hospitals, to staff first responders, but we're going to harm society by doing this, and there's no point to it. Now that we know that even if you're fully vaccinated, you can get infected, you can transmit the disease. Well, that's the same thing as if you're unvaccinated as well. So what's the distinction? What's the difference? So I think it's about time we recognize natural immunity. I know one research has pointed to over 140 studies that show that natural immunity is as good, if not better, than vaccinated immunity. And again, unfortunately, as a big supporter of Operation Warp Speed, I'm not anti-vax at all. But unfortunately, the vaccine is not proving to be as effective or in some cases as safe as we all hoped and prayed it would be.
So you're behind this Wisconsin proposal as well, Senator. I'm guessing the CDC in your opinion, are they a little behind this? Even the NCAA has now changed its guidelines as a result. Are they ahead of the CDC on this?
Well, I think the CDC and the FDA and the NIH has been behind the curve on COVID since day one. The first thing they've totally dropped the ball on is early treatment. We should have robustly researched and explored, and we should be recommending a cornucopia of different drugs that are cheap, generic, widely available, and safe to treat COVID. There are hundreds of doctors that are doing this effectively, but the CDC, NIH are just basically relying on expensive new drugs, the expensive vaccines. We've poured billions of dollars into these things, and we've completely ignored, cheap, widely available, safe, and from what I hear, very effective repurposed drugs as well. The CDC, the health agencies have not been transparent. They have not been honest with the American public. They've had a singular focus, vaccines, 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 and they really don't have a response. Now we're finding out that vaccines aren't all that they were hyped to be.
Well, they work. I mean, we know that. That's the one thing we do know we have in the toolbox. And I guess my question, we've been on this natural immunity thing for months, Senator. We've talked with the doctor you've consulted with. In fact, we're going to talk with you more here in a minute. I go back to an Uber driver months ago who told me about how he and his wife had COVID, and they were alternating antibody tests to track their immunity levels. And when it got to a certain level, low enough, then they'd get the vaccine. I guess my question is, why aren't we focusing more on antibody testing instead of just whether you're positive or negative?
Of course, that's something Dr. Norchasm has spoken relentlessly about over the months. It makes no sense. I mean, the CDC, I think it was the CDC, came out and recommended against antibody testing, even though there was some concern that if you had natural immunity, if you'd previously been infected, you might be at greater risk of getting the jab. So again, the CDC policy, healthcare agency policies haven't made sense from the start. It's about time that we actually do let the science dictate and direct our actions.
So even if this passes in Wisconsin, Senator, it sounds like the governor is going to veto it. Are you at least encouraged that this is more a part of the conversation and the discussion now?
I'm getting a sense the dam is breaking. I think the suppression of information, the censorship, is not going to last for long. When you have, for example, Joe Rogan doing interviews with Dr. McCulloch and Dr. Malone, and these things getting 40 to 50 million views, the good thing is censorship is no longer particularly effective. And so people are asking questions. They're legitimate questions. We should have been disseminating information. We should have been using the internet to have these courageous doctors that are actually treating COVID patients exchange information with each other rather than rely singularly on the pronouncements of people in the CDC and the NIH and FDA who, let's face it, they're not practicing medicine. They're in the ivory towers. I would much rather put my faith in the doctors that are in the trenches, exposing themselves, often getting COVID themselves, and listening to what they have to say, at least as a second or third opinion.
Senator, I guess you say you're not anti-vax, but why not come out then and say, look, this thing works, get it if you want or don't, but it works?
Well, part of the reason is the people I know that are getting infected right now and seriously ill with COVID have been fully vaxxed and they've been boosted. So the truth is the vaccines are not as effective as we all hoped and prayed they would be. They are losing effectiveness, which is why we're asking for a third booster, sometimes a fourth booster. I mean, let's be honest about this. Again, I was a big supporter of Operation Warp Speed. I hope these things would have been 100% effective and safe, but they're not. We have to be honest about that, assess the reality of the situation, and recalibrate what our recommendations are.
Well, they were never promised to be bulletproof, but as we know now, the effectiveness and the protection does wane, but it also wanes with natural immunity. Listen, Senator Johnson, we've had you on a couple times now and tried to get you to tell us whether you were going to run for re-election. Now we know you are. So the next time you're on, we'll talk about that and some of the other things facing you in the Senate. But thank you for the time tonight. We appreciate it.
Stay well.
All right, you too. Thank you for watching. Click the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.